All right, listen up. My name is PhD candidate Tracy Walker. Thank you for tuning in. Welcome to my IR suite. This video is going to be about interventional radiology, aka IR. Behind me is our latest IR machine. Over here is the C-arm itself, and over there is a radiofrequency ablation machine. Remember, throughout this video, if you have any questions about anything that I do, I am registered in CAT scan, X-ray, MRI. If you have any questions about salary, about the whole entire radiology umbrella, I am your radiology liaison. So if you have any questions about anything, put them down there in the comments, and I kid you not, I'll reply to every single last one of you. Sometimes give me a day or two, but usually I'll answer your questions in the same day. All right. Typically, when referring to interventional radiology, people are referring to the vascular side, the arterial side of things. For example, DVTs, port placement, IVC filter, arterioplasty packages. What I do is something called pain management. Patients get referrals to us because they are experiencing pain, typically back pain, neck pain, anything related to the spine. We treat those ailments. Our exams consist of medial branch blocks, radiofrequency ablations, transforaminal steroid injections. Sometimes when people have pain, nothing resolves the pain, not even after surgery. If patients are experiencing pain still after surgery, they are referred to us. Car collisions, any catastrophic back injuries, that's what we do. We help alleviate those pains with procedures by delivering medications to those problem areas. They can be cumbersome, and people have been dealing with them for long periods of time. And what we do is help people live without the pain. Here are some examples of how an IR procedure is going to work within pain management. So what I do with the X-ray machine is that I guide the doctor when he's using needles into the patient so he can get the correct placement of his needles. And then as we go along, we're taking different views so he can get the perfect vantage point to reach the part where the patient has pain so he can inject the medication. Here in this next image, we use contrast so he can see if the contrast is going where it belongs. So right here, it's not right. But once the contrast gets right here around the joint, you see how this is highlighted around this joint right here. The contrast is going up and it's coming down. Then the doctor knows that he's in the right spot. All right, so I've gathered a three-dimensional model of a spine, and I'm going to show you what kind of things we do to help the patient. All right, so first I should remind you that IR, aka fluoro X-rays, produces two-dimensional images. So what I do, I take pictures from different projections, anterior or laterally or in an angle, so I can help the doctor guide his needle into these cumbersome problem areas that give the patients pain. These are the nerve roots right here, these yellow guys right here. So a common procedure is called a medial branch block, where we target these little nerve endings right here. We inject it with numbing medication, and if the numbing medication makes the patient's pain goes away, then we do a more permanent procedure that permanently makes the pain go away for 6 months up to a year. These nerve endings, these root endings do grow back, so that creates a constant flow of revenue, bringing the patient in and out every 6 months to a year to treat their pain. If the medial branch block does not address the patient's pain and the pain doesn't resolve, then there's various other procedures we can do to help the patient's pain go away with different types of injections in different spots here, or around here to make their pain go away. So I like to leave my viewers with something every day, and within all my videos. What I want to talk about real quick is burnout. So check this out. You're a new student, you graduate from accredited x-ray school, whatever it is that you do, and you're excited. You want to become a travel tech, make $50 an hour, entry level, and you think about all this money you're about to make, but one thing you forget about is burnout. So within x-ray, patients can be back to back to back some days. They're walk-ins. They can come in any time. So your work life is based on people walking in. There is no set busy hours, morning or afternoon. Sometimes it could just be all day. And after years of just doing walk-in patients, you can reach burnout. So you may start looking into something else. And what I mean by that is you want to start looking into more of a routine where patients are scheduled instead of walk-ins. And that's where IR comes in, which I'm going to be talking about. Mammo, MRIs. You cannot do a walk-in MRI. You can't do a walk-in IR procedure. There's pre-ops. There's a lot of things and steps that you have to do to prepare for a mammo case, biopsy, pain management procedure, radiofrequency ablation. There's just way too many patients. There's way too many people who need MRIs for everyone to just be walk-ins. So everything is based on a schedule. So with that being said, I feel like MRI, CT, IR, pain management are things you can look forward to once you reach burnout. And the good thing about x-ray, the x-ray and whole radiology field, is that you do not need to go back to school. I can explain that to you further, but without further ado, I'm going to jump right into this video. All right, guys, so remember that I promised you that we're going to be talking about salary. And to be fair, I'm going to make it easy. And we're going to talk about, we're going to use Texas, for example, and I'm going to put it in hourly rates. And this is just after graduation. You just became an x-ray tech, got your diploma, you get your first job. This is a rough estimate of where you're going to be starting at, $26, $27 an hour on your first day. And then if you cross-train, remember I was telling you, you do not need to go back to school to do CAT scan, MRI, mammo, or IR like we just discussed in this video. All you need to do is cross-train, knock on your supervisor's door, go talk to another department supervisor and see when you can get in. Don't stay stagnant up here at x-ray. Move up. And when you move up, these are the ranges where you're going to be starting at. I know there's a lot of gatekeepers out here and they're preventing you from moving up, and a lot of employers want you to stay where you're at. But you got to show that you're hungry on the first day. If they don't know that you want to move up, then you're never going to move up. So you want to cross-train in these things so your dollar amount can go up. So let's cross that out. Maybe even, I know people in Houston who make $50 doing MRI. Same for ultrasound. I know people who make $50 an hour here in El Paso who get that amount. And also within ultrasound, there's a bunch of modalities within ultrasound. There's vascular, there's abdominal, there's, mother baby, all that stuff. And they all have different starting salaries. And then if you want to get in the $50 an hour range of starting, that is nuclear medicine and also radiation oncology. That's injecting the radiation into the patients, and this is shooting the radiation through x-rays into the patient to eliminate the cancers. All right, nowadays I've learned in the comments and I've learned that schools who sell x-ray, MRI, ultrasound programs, they're monopolistic. So what that means is that they are trying to maximize the most money that they can get from its students, from its candidates. So they are requiring more and more prerequisites before you even can start their X-ray program. X-ray, ultrasound, MRI, they all are supposed to be 2-year certificate associate's degrees. They're 2 years, but it's gotten so greedy that they've shoved so many prerequisites into a school to where it takes 3 and 4 years to get your associate's degree, to get your certificate to do these things. Remember, school is hands-on. So you're doing didactic, that means in a classroom, and then you're going to training sites like hospitals and clinics to get your hands-on training, and that's where you learn how to do your job. And that's why these certificates pay more than bachelor's degrees, and you get a job, versus a bachelor's degrees, which takes 4 to 6 years to get, with all the prerequisites that have been shoved into them because of greed. Now people are graduating and finding out that their diploma in art doesn't get them anything. So that's where these trades come in: barber, electrician, X-ray, ultrasound, HVAC, truck driving. All those things pay more money than bachelors, and that's why I'm trying to spread awareness. So if you have any questions about anything, I'm gonna stop ranting. Just hit me up in the comments. I got your back. One last thing that I forgot to add is that you do not get paid extra money from being registered all the modalities. You don't get extra money. Like, here's an example. If you're doing MRI, you're only getting paid to do MRI. You're not getting paid extra because you have these. You might get paid extra if you know Spanish, but you're not going to get paid extra if you have these. Same for if I'm doing CT. CT gets paid less than MRI. So if I'm doing CT full time at an imaging facility, I'm only going to get paid for CT. I'm not going to get paid more for being registered in MRI. And that's the same for X-ray, IR, or anything else. You do not get paid more, and that's one of my common comments within the comment section. All right, guys, this is my beloved lead aprons. These personally belong to me, hospital property, but I have been in charge of these. We want to make sure they're always hung up and laid out flat or hung neatly. You don't want creases in these because this is what protects you from occupational exposure. Although you're already standing 6 feet back whenever you're taking x-rays anyway, the dose is already generally low, and you get more radiation dose from cosmic exposure, cosmic radiation, than of occupational radiation. Alright, so these are very heavy, and you're wearing these for an 8-hour shift. Your back will hurt. You gotta, with time, you'll get used to them. You may not get used to them. My back still hurts when I use these. Just make sure that you do your exercises. When there's a break in between patients, you take off the top part. This is a top and bottom piece. Some of you just have one huge lead apron that just goes over you from top to bottom. This is a top and a skirt, so they're 2 separate pieces. So you can wear either the top or bottom, or wear both of them. But like I said, it's good to take it off and have a break. Another thing I want to talk about when moving this machine is patient safety and safety for yourself. This machine is very heavy. I know I may look like the perfect physical specimen. Just kidding. But this machine is very heavy. So when you move this around, use both hands at all times. Whenever you're getting ready, whenever you're getting ready to turn the wheels on them, you want to make sure you use both hands when manipulating this arm. Using one arm is not safe. You want to make sure you use your body and plant your feet when moving this machine, because I've hurt my shoulder twice. I have 2 minor tears in my shoulders from manipulating these machines and pushing it without using the proper form and the proper technique. You want to use both of your hands and grip it at all times when moving it. If you do not, you will hurt yourself. You may think that you're invincible now, but you will hurt yourself. It hurts a lot, and tears are lifetime injuries, even if they are repaired. All right, moving on. So this right here is your classic machine. This is one of the newest machines. One thing about C-arms at your hospital or the hospital you're going to work at, the C-arm is probably 2 or 3 decades old. The reason why is because they never break. There's not really a reason for them to break unless a doctor demands a lot of high fluoro and causing the tube to burn out. But if you take really good care of your machine, the machines will never break. And that's one thing I'm proud to have a GE. We're in a new hospital, so this is the OEC Elite machine. Comes with a monitor and also a monitor on the C-arm itself. You can turn all the way around so the doctor can see it or you can see it in case this is out of view. But everything that you can do on here, you can do on here. Give you a quick little rundown of the machine. If you want to look at the images, here we go. You can look at the old patients. I'm not going to pull up any patient information. You can put annotations on the images itself. Let's see, let's come over here. There's one thing that's really unique about C-arms is that it has an AEC and it automatically gathers the correct KVP in mass, so there's never a need to adjust this. So better yet, if you do adjust it because the patient thickness, you might want to just use this instead because it'll make the images grainy. So with time, I've learned that I've been doing IR for 6 months for a clinic, and you never want to adjust the mass in KV, ever, never. Patient's thin, the patient's thick, it doesn't matter. You want to just change the settings this way. So if it's say if you're doing the neck and the patient's thick or it has broad shoulders, just use the spine histogram to penetrate through the patient's shoulders. All right, let's come over here to the table. The thing that's important for an IR table is that you want it to be radiolucent. You don't want it to have metal bars coming through here. You want the x-rays to go through here and out here, so this can go in between so we can see the patients. A lot of the tables have metal on them, and when there's metal on it, it's trying to penetrate this and the images won't come out. So that's one important thing to have with an IR table. All right, guys, and it's a wrap. Thank you for tuning into my video. Like I said, if you have any questions about anything that I said, put it down in the comments. I kid you not, I will reply to every single last one of you. Also, if you guys want to hang out with me outside of YouTube, I play this video game called Dead by Daylight. It is cross-play enabled, PS4, Xbox, PC, whatever. My gamer tag is Hardbody Tough, capital H, capital B, capital T. And also, if you are into fitness, if you like nutrition, you want tips on losing weight and how to eat, I have videos on that. Check these out right here. If you like cars, I have a few car videos. All right, guys, it's a wrap. Peace.